What is the effect of cardiopulmonary bypass on systemic inflammatory response syndrome, SIRS? A. It reduces SIRS by decreasing cytokine release. B. It causes an exaggerated inflammatory response, contributing to SIRS. C. It has no effect on the inflammatory response. D. It improves the body's ability to regulate inflammation. Answer: B. It causes an exaggerated inflammatory response, contributing to SIRS. Explanation: during CPB, the body's systemic inflammatory response is often activated due to contact with the foreign surface of the bypass circuit and the release of cytokines. This can lead to systemic inflammatory response syndrome, SIRS, which may increase the risk of organ dysfunction. Managing inflammation during CPB is important to minimize postoperative complications. What is a potential consequence of rapid correction of metabolic acidosis during cardiopulmonary bypass? A. Severe hypotension. B. Metabolic alkalosis. C. Hypothermia. D. Hyperkalemia. Answer: B. Metabolic alkalosis. Explanation: rapid correction of metabolic acidosis by administering large amounts of bicarbonate can lead to metabolic alkalosis, which occurs when excess bicarbonate shifts the pH of the blood too far toward alkalinity. This can result in complications such as arrhythmias and electrolyte imbalances. Therefore, bicarbonate is often administered slowly and in controlled amounts. Which of the following is a risk factor for developing hyperglycemia during cardiopulmonary bypass? A. Short duration of surgery. B. Insulin resistance. C. Low body mass index, BMI. D. Hypothermia. Answer: B. Insulin resistance. Explanation: insulin resistance is a common condition during CPB due to stress-induced hormonal changes, which include increased levels of cortisol and catecholamines. These changes reduce the body's ability to utilize insulin effectively, leading to hyperglycemia. This makes blood glucose management essential during surgery. During cardiopulmonary bypass, which of the following metabolic changes can result from the hemodilution of blood? A. Increased blood viscosity. B. Decreased hematocrit and oxygen carrying capacity. C. Increased plasma protein concentration. D. Decreased glucose levels. Answer: B. Decreased hematocrit and oxygen carrying capacity. Explanation: hemodilution during CPB reduces the concentration of red blood cells, hematocrit, and, consequently, the oxygen carrying capacity of the blood. This is mitigated by using an oxygenator in the bypass circuit, which helps ensure adequate oxygenation, despite the lowered hematocrit. What is the role of colloid solutions in the management of metabolic parameters during cardiopulmonary bypass? A. To correct electrolyte imbalances. B. To improve blood pressure and perfusion. C. To enhance glucose metabolism. D. To promote diuresis and fluid removal. Answer: B. To improve blood pressure and perfusion. Explanation: colloid solutions, such as albumin or synthetic colloids, are used during CPB to maintain adequate blood volume and improve circulation. This helps support blood pressure and ensures proper tissue perfusion, which is vital for maintaining metabolic stability and organ function during the procedure. Which of the following strategies is commonly used to manage hypothermia-induced metabolic changes during cardiopulmonary bypass? A. Continuous blood warming. B. Administration of vasopressors. C. Enhanced ventilation to remove CO2. D. Aggressive fluid resuscitation. Answer: A. Continuous blood warming. Explanation: hypothermia during CPB is used to reduce metabolic demands. However, it can cause changes in metabolic processes such as reduced enzyme activity and altered drug metabolism. Blood warming is used to carefully regulate body temperature to avoid the detrimental effects of both excessive hypothermia and rewarming, while maintaining adequate organ protection. Which of the following is most commonly used to reverse heparin during cardiopulmonary bypass? A. Vitamin K. B. Protamine sulfate. C. Calcium gluconate. D. Sodium bicarbonate. Answer: B. Protamine sulfate. Explanation: protamine sulfate is the standard agent used to reverse the effects of heparin during CPB. Heparin is used to prevent clotting during the bypass, and protamine is administered at the end of the procedure to neutralize its anticoagulant effect and allow normal clotting to resume. What is the main purpose of monitoring lactate levels during cardiopulmonary bypass? A. To assess glucose metabolism. B. To evaluate oxygen delivery and perfusion. C. To monitor for electrolyte disturbances. D. To detect metabolic alkalosis. Answer: B. To evaluate oxygen delivery and perfusion. Explanation: Lactate levels are commonly monitored during CPB because elevated lactate indicates anaerobic metabolism, often resulting from inadequate oxygen delivery to tissues, ischemia. High lactate levels are a sign of poor perfusion and tissue hypoxia, which can lead to organ dysfunction and other complications. Which of the following is a potential complication of inadequate glucose control during cardiopulmonary bypass? A. Increased risk of infection. B. Decreased platelet function. C. Reduced cerebral oxygenation. D. Impaired drug metabolism. Answer: A. Increased risk of infection. Explanation: Inadequate glucose control, particularly hyperglycemia, during CPB has been linked to an increased risk of postoperative infections. Elevated blood glucose can impair immune function, including neutrophil activity, thereby making patients more susceptible to infections. Which of the following metabolic abnormalities is most likely to occur during rewarming from cardiopulmonary bypass? A. Hyperkalemia. B. Hypoglycemia. C. Metabolic acidosis. D. Respiratory alkalosis. Answer: A. Hyperkalemia. Explanation: Rewarming after CPB can lead to a shift of potassium from the intracellular space to the extracellular space, causing transient hyperkalemia. This is due to the fact that potassium is more concentrated inside the cells, and as temperature increases, potassium is released into the bloodstream. Hyperkalemia must be monitored and corrected to avoid arrhythmias.